Ladies and gentlemen, thank you for staying with us. If you have just joined us, a very big welcome. The topic for discussion tonight is diabetes in the community, and I'm very fortunate to have a guest in my program. Her name is Helen Snowden. She is the lead nurse in the local community. She's been serving as a nurse for the last 35 years, but especially for the last 17 years she's been working in Tower Hamlets, serving local people, dealing with day-to-day issues that affects the community. She's also worked in Bangladesh in the British High Commission, looking after the High Commission staff and their families, as well as people from the local community. She has a vast experience in the community. She has a vast experience of serving people with diabetes, looking after them, and I'm delighted to have her in my program tonight. I hope that through this program you would be able to pick up some life-saving tips on how to control diabetes, how you can go on about doing your daily business and not worry about it. Helen will be able to provide any answers to your questions that you may have. So we have a live phone-in program. It's a free line where it won't cost you anything. Should you wish to know anything about diabetes, please feel free to call our studio and speak directly to Helen. So Helen, just before we were going onto the break, we were talking about local authorities' responsibilities, what is it that they can do, and also the NHS responsibilities. Let's focus on that, but in terms of education, is there anything that perhaps our schools should be doing to educate not just young people, but the community at large?
I mean, I think it's vitally important that any health messages are started at a very young age. I think nowadays people understand a lot more about what diabetes is, but looking at the research, young people say they're given more of a biological aspect, so people understand, you know, the body's response, but not so much the health implications.
Sure.
You know, we're starting to have initiatives now where GPs and nurses, health professionals go into schools and talk to people. So it's starting at secondary school level, but I do actually think we should be starting at primary school,
Right.
you know, where we're getting children to understand what they can do themselves, you know, take responsibility for their own health at a young age. And also they influence adults, don't they, you know?
Sure.
You know, they're brilliant at stopping people smoking because they will, you know, put so much pressure on parents that they hopefully eventually will give in smoking. So, you know, they've got a huge amount of future ahead of them, so we want them to have a healthy lifestyle.
Yes, of course.
But also it's about the next generation being educated and understanding everything around health, particularly things that affect their local community like diabetes.
So it's important to start education, you said, from an early age. At the moment you're doing some work with the secondary schools, but you would like to see that being extended to primary schools.
That would be brilliant. That would be really good.
Let us hope that happens fairly quickly.
Sure.
And that we would be able to control diabetes from an early age, or certainly the understanding of what and how to control diabetes. But let's move on to the NHS again. I mean, what else do you think that NHS can do with the community to support those with diabetes?
So I think it's vitally important that we get out more into the community. So, for example, going to health fairs in the local community, possibly offering more testing, you know, in the local community by having stalls at the market and places like this where people can easily access information. I guess making sure that people have the information that they understand in simple layman's terms, I think is really important as well.
What about having that information in different languages for those
really
that do not speak
Sure, I think
English as the first language.
Sure, I think it's really important. We do have a lot of Bengali-speaking health advocates now in the local community who do spend a lot of time working with patients that
But that could be any communities, couldn't it?
Yes, yeah, right. that you know, they work with the patients. So I think we do have that here in East London. And I think it's really important that people make use of these local facilities as well that are
Sure.
available. So not just your GP practice, but you know there are information sessions going on regularly, and as I mentioned about the pre-diabetes courses as well.
Sure.
That are available. So it's accessing all these things that are out there. Possibly using UK diabetes websites as well.
Sure. In terms of checkups, I know it's something we've talked about earlier on, but perhaps we haven't emphasized the point. How often should people have a checkup in their GPs?
So every diabetic patient has to have an annual review. So that's the gold standard, and this is what's recommended from the NHS. So it's given that this opportunity to have a full checkup, have blood tests, check your feet for any problems, any complications. We do urine tests, blood pressure. So it's what I call, you know, an MOT. So you get that annually. And then for patients that need extra support and help, you know, we like to see people every 3 months. If everything's stable, patients are well, there's no complications, then we can see them every 6 months. But the most important thing is that everybody with diabetes must go and get an annual health check. It's so important, because that's the opportunity to get everything.
So what happens at the annual health check?
So we do blood tests, we do foot checks, we do urine tests. We're checking to make sure people don't have any problems if they're on medication.
Sure.
We may need to alter the medication.
Sure.
We may need to start different types of treatments.
Sure.
So we're protecting people from
So it's important for people to...
vitally important, yeah.
Right.
Yeah.
So it's important that they understand and have it done on a regular basis.
You know, and it's really important to get your eyes tested.
How do you target those people that don't come on a regular basis, say on an annual basis? How do you make sure they come to the surgeon and get a review done?
Well, we've got a variety of options nowadays. So I think letters have really pretty much like gone by the by now. We're targeting people with text messages. People respond much more to text messages. Phone calls, it's quite nice if you get a personal invitation.
Sure.
We do send letters to people that we don't have a mobile for, and we can email patients as well. So now we're using much, you know, more electronic methods of contacting people.
And all of those modes of communications are important still.
Sure, and also even the pharmacists can be involved if people are on medication. They'll say, you know, they'll do a medication review, say, have you seen your, you know, diabetes nurse or your doctor for your annual review. So I think pharmacists have got a big role to play as well.
Fantastic. So everyone's working as a team.
I think so, yes.
Good. I'd like to perhaps ask you another question in terms of prevention. Is there any other preventative measures that people can take other than what we've discussed so far?
I mean, I think the key thing is remembering to try to keep your weight down. People that are overweight are much more at risk of diabetes. So if you can keep your weight down, there's a chance that you will not develop diabetes, or you can even reverse diabetes. So one of the key things I think is trying to stay slim. That's what I would say to people. If you can stay slim, it's really, really the best thing you can do for your health. And not smoke, because again, that adds to the complications of the heart and so on. Okay.
So stay slim, not smoke are the other preventative measures that you think people need to do. All right. Great Britain have at least 1 in 10 person that have diabetes of mostly type 2s.
That's correct.
How does Great Britain compare with other countries in terms of perhaps preventing diabetes or treating people with diabetes?
I mean, there's such a variety throughout the globe. The advantage that we have in the UK is that we have a fantastic National Health Service.
Yes. Well, it was fantastic.
It still is. So we get free medication for patients that need it on are diabetic, which doesn't happen in many other countries. And I think it's remembering that we have amazing services such as the diabetes eye screening service, which helps prevent people going blind. So there's all these fantastic free services which are available. I think they're really, really important that people take up those opportunities, you know, when they're offered.
So, yes.
And I think
I suppose we are very grateful,
we're grateful
for the lovely NHS service that we have despite the crisis that we're going through. In comparison with other countries, yes, definitely we're in a much better position. But what I was thinking of in terms of research,
so we are looking
how
at
do we
things.
compare with other countries in the world?
So we're looking at, we're offering in the East End of London, we're offering some gene research to look at what is the genetic component, what is it that makes people more prone, such as South Asians, to having diabetes.
Okay.
So there's a lot of research going on in East London with the Queen Mary Institute, the university.
Tell us a bit more about that. How is that happening?
So patients are being offered the opportunity to have some blood tests taken. They can then discuss the results and look at the whole, you know, pattern around what makes it in people's genes, their DNA, that makes them more prone and likely to be involved, you know, and develop.
And how long has that research been going on for, and when is the result likely to be out?
So that's been going on for about a year now.
Okay.
So I think it's a long-term study.
Okay.
In other countries, you know, they're looking at other initiatives to help prevent some of the diabetes epidemic that we talked about. So for example, in Holland, I know that they're doing lots of work around encouraging young people in schools to be healthier, so that even from a young age, sort of primary school age, they're doing things like when they celebrate birthdays, they have, you know, celebrations with, you know, fruit kebabs rather than, you know, children don't bring sweets into school, don't have fizzy drinks. So there's all these sort of healthy initiatives going on in other countries.
Right. Do you think Great Britain could adopt a similar strategy?
Well, I would hope so. It'd be brilliant if they could. I mean, you know, there's a golden opportunity to copy some of these examples that are going on, even just in Europe, you know, that I'm sure we could learn from.
But won't that have an impact on the economy itself?
Oh, you know,
do you think the government is committed to do such thing?
Well, there's a lot of problems around advertising of unhealthy food, isn't there, you know? Yeah. And I think that we're starting to tackle these issues now. I think there's to be pressure put on the government to not, you know, have, for example, you know, unhealthy foods advertised and fizzy drinks advertised, you know, making sweets readily available. Yes. So there's a huge amount of work that can be done in that area, I think.
Sure. Local support group. You've mentioned that we don't have anything locally that supports.
So sadly, we don't have a Diabetes UK support group, which is it's a charity, and they do have different ones in some parts of London, but unfortunately there isn't one in the East End of London, where I would hope, like in Tower Hamlets, that would be such a great need for it, you know, because people get a lot of support from their peers.
In terms of people's life expectancy, I mean, I know we're living in the East End of London, but you've mentioned earlier on, when I was having a chat with you outside, that perhaps if you compare life expectancy of people living in East London with perhaps, say, those living in Richmond, if you live in Richmond, you could survive for 15 years longer than people living in the East End of London. Why is that?
I mean, there's a combination of factors, I think. Some people think that some of the issues are around poverty and unhealthy choices in terms of food. People obviously, you know, that are on a limited budget will choose, you know, carbohydrate-rich foods. It fills you up quicker, and it makes you feel fuller. So I think there are some issues around dietary choices, poverty, and unfortunately some socioeconomic issues around, you know, people's sort of cultural beliefs as well.
What about air pollution, housing?
I'm sure air pollution is much worse in East London. I think we've got evidence of that, haven't we?
Sure.
Housing's much more condensed and a lot
so
more
all
people.
of this could have an impact in
it will have an
people's
impact, yeah.
life expectancy then.
Absolutely.
Right. Helen, I personally know and I'm aware of the good work that you're doing out there in the community, but is there any new strategies that you are working with at present?
So yes, we're definitely looking at working more in groups of patients as opposed to just on a single one-to-one basis. I think, we found that we all get support and help, and I think we're influenced quite a lot by our peers. So what I've found is...
Is this a group chat show with patients?
It's a group consultation model.
Right, okay.
So rather than having a consultation on a one-to-one with a health professional, you'd have a group, if patients
group of people
agree,
with similar problems,
they work together in a group, and we'd have specialists coming in. We do have like pharmacists coming in, dietitians coming in, and everybody working together as a team. So a combination of a group of patients and a group of health professionals together seems to be working really well.
Sure.
And you get support and help and ideas.
And how successful has that been?
So far, we've found it's been really successful, particularly in the area of women, and encourage them to exercise more, because sadly, in the UK, only 13% of South Asian women actually achieve the target of, exercise, which is
only 13%.
13%.
Oh my God!
For men,
how does that compare with perhaps the indigenous community?
I don't have figures for that, but it's a lot less.
Right,
and for men, it's 26% of South Asians only achieve the recommended levels of exercise. So I don't think any of us are doing enough exercise, but unfortunately, it shows that sadly the women are doing even less than they should be.
So in your opinion, what is it that we can do to encourage women to make sure they do take up these exercises?
So we have
on a daily basis.
Yeah, we have programs such as Good Moves in East London, which is it's run by the local, by a local NHS provider. So it encourages people to do more exercise, and particularly women's only groups are very popular. So that people could join Good Moves programs. They can hopefully start to, like you mentioned, access, like the women's swimming programs.
Yes.
Hopefully the outdoor gyms that are appearing more now. We are getting a few more in East London. I've noticed, people are starting to use those a bit more. And even if you can go out with friends, just going out in a group encourages people to do a bit more exercise.
We are coming almost to the end of our program. We've got just under a minute left.
Okay.
What is the perception of young people with regards to diabetes, do you think?
I think younger
because they are our future, aren't they?
That's absolutely right. Younger people are much more aware of diabetes and the impact, and I think they're aware that things need to change. We need to produce a healthier next generation. Okay.
And do you think that is happening at the moment? Because when we were growing up, we used to go to the local park, play football or run about.
That's right.
Nowadays, more and more young people are stuck at home, either on their computer or mobile phone or the tablets or whatever. They're not doing as much physical exercises as we used to do.
That's right.
And surely that can't be healthy.
It's definitely not healthy, and I think it's that theory-practice gap. I think they're very educated and know what they should be doing, but actually not doing it. So I'm hoping more young people start to get out, play football, play badminton, do squash, start doing regular exercise, even just walking, would make a huge difference to their future health.
Thank you, Helen.
Thanks.
Is there anything else that you'd like to say for our viewers before we come to the end of our program?
I'd like to say thank you very much for inviting me. It's been a wonderful experience, and I really hope that people will get some hopefully useful advice and information from this program.
Thank you very much, Helen, for coming along. Well, thanks. Ladies and gentlemen, I hope this program has been some help to you, and that through this program, you have been able to learn the symptoms of diabetes, what you should do, and please go and visit your doctors regularly. And with that, I shall say good night to you. Thank you for watching. We shall be back on air again in 2 weeks. Good night.